DEI just a buzzword, or does it encompass something more profound? In this episode, we're discussing diversity, equity, and inclusion in pharmaceuticals and medical devices with Celia Sandhya Daniels. She has 25 years of experience in the life sciences industry, and we'll be discussing the following. Why is DEI crucial? How can we reconcile the goals of DEI with privacy concerns? And how does the FDA prioritize certain intersections more than others in its risk-based approach to DEI? Stay tuned and let's get into it. I want you to talk a little bit about the importance of DEI. Why should it matter? And we'll go from.
Yeah, absolutely. One of the things that I always tell the companies when it comes to the DEI is it's important to have DEIB, which is the belonging part of it. And equity is the most important thing in DEI, where you feel that a person who is part of the company needs to have the same kind of salary structure. The equity in the company needs to be addressed first. But breaking down DEI, I always say this, that DEI is all the way from the bathroom to the boardroom. And to me, that's a very interesting thing because why are we talking about bathroom here? Oh, yeah, of course, it's important because I'm a trans person and I need to be in a company where I feel included, accepted. And when I'm in certain spaces, even as basic as a bathroom, where I feel like I'm not, I'm being accepted in that company, in that environment. So that's sometimes missed out in the DEI structure and the framework within the company. And that's why I say that DEI is always from the bathroom to boardroom. Now, answering some of your points that you mentioned about not politicizing it, I think when you're working as an employee in a company, it's so important to look at the basic needs of the company. The person is feeling psychologically safe in the company and they're able to speak up. They have a diverse background, and companies that are having a diverse background, they seem to have like more women in the board or folks who are from different ethnicities, race, women of color, trans women. It creates such a difference and it increases the creativity. It improves the productivity of the company. And also looking at 2030, almost 70 to 75% of the workforce are going to be millennials. Now, we have a lot of work to do. So in terms of that, I think it's important for companies to start thinking about different areas that will become more, that will sit well with the millennials and Gen Zs. The issue that I also saw was, especially when I talked to my daughter, she's 23 and she is in the environment and she's in energy and sustainability space. The kind of issues that she talks about in a company is much so different from the ones that I have been when I was her age back in Dun and Bradstreet when I was kind of starting those days. So to me, that matters a lot because the way she looks at environment, the way she looks at energy, the way she looks at a planet, it's so different. And the way she looks at people is so different. She has a lot of friends who are from different backgrounds and ethnicities. Her best friend is gay, and she has another friend who's pansexual. It's non-issue for them. But for folks who are probably don't have that background, they don't understand the transgender community or gender diverse community. So it's always good to educate folks, and it's always good to have those kind of environment where you are having a culturally appropriate training to understand different ethnicities and race, so that and also people with disabilities, people who are veterans, people who are part of the LGBTQ community, and young folks who are entrepreneurs who are helping the company to thrive in terms of how they want to be known in the company. There are a lot of ERGs within the company as well. So it's good for companies to have ERGs focus on diversity and have a meaningful dialogue with them. So the companies are not performative, they are truly transformative. And that's what we want from diversity. And diversity shouldn't be a term, but it should not be just representation, but it should be meaningfully aligning with business in terms of how you bring the value to business within your ERG groups. So I sometimes call ERGs or BRGs because business resource groups aligning to the business outcome of what they want to do is highly essential in companies. It's not just about Pride Month or Black History Month or Hispanic Month, but it has to be beyond that, where you feel like I'm adding value to a particular development work that's going on, to a product development work that's going on, the quality assurance, the way in which it's marketed in various countries. So DEI to me is not just internal, but also external. And that's why when companies are having products, especially when you talk about companies like Bud Light, Budweiser, and Target, they have done what is good for the employees, but when it hit the community outside, they didn't think about the customers who are from the LGBTQ community. Sometimes it's so mindful to have that one. They could have probably taken the story and said that this is what is important. It's not a political issue, but it's a human issue. We are talking about social issues, and why we want to do this. And they could have created a good story, but they backed off, and now the employees feel betrayed. The customers feel betrayed. So there's a lot the companies need to learn from what's happening today, and why we need to change this is because when you look at human beings as human beings and how can I help another human being, the attitude in the company changes. And that's so important. That builds your leadership trust. It also builds the kind of change that doesn't come from the letterhead of the company, but also from the change needs to come from the heart of the employees too. So it's so important for companies to work with their employee population and also the consumer population to create that kind of change in DEI.
But let me ask you a really basic question. And I come at this from a process viewpoint. And from a
Absolutely.
process viewpoint, I think all processes start by a simple gap analysis.
Mhm.
Where do we want to be versus where are we now?
Mhm.
And to do that, you have to measure. To do that measurement, you have to ask people, how do you identify? I'm in various leadership functions across different places, and we recently were looking at this question in a scenario where we were saying we would like to have more diversity. So we said, great. How are we going to do that? Let's measure who's already in our leadership functions. And there was no argument over should we look at gender. There was no argument over should we look at race. The moment we put sexuality in there, question became, do we ask people? Would people want to answer? And that's when the question became the awkwardness around that, asking people to out themselves. So when you're talking about DEI, there is the intentionality of doing good, but how do you balance that against the need for privacy, the idea that some people aren't ready to come out, but that you want those voices represented on your boards or in your leadership or anything else like that?
Absolutely. I think it's an important question when you're looking at self-identification, right? Self-identification is absolutely key in companies. And I was running this project for a large biopharmaceutical company. And when I ran that, and I did a lot of analysis, not just in US, but across the world, looking at the global acceptance of how people would like to be accepted in the workplace. Suppose you are in Dubai or in another country where LGBTQ folks are frowned upon. Now, how will you even tell your employees to come out? So it's important to be mindful of what data people are comfortable with. That is internally. We're talking only about internal aspect of it. Let's say you're a pharmaceutical company and you're working with your internal employees. You want them to identify because you want a diverse group. You want the EEOC data, and but that's only having male, female, and choose not to declare. Now, the choose not to identify, there are a lot of folks who are part of that community where trans folks are part of a community. Sometimes folks who identify with a different sexual orientation, they don't want to put any data there. They don't, and sometimes even women don't do that too, because you have not really told what is your intention of what you're going to do with the data. And they are concerned about it because they are worried about the privacy and security part of what is being disclosed. As much as you want your company to be mindful, as much as the leaders want to be mindful of their employees, it's also important that they create that trust within their employees. Now, you cannot create a change within your unrecognized groups within the company unless you really understand what issues they're going through. And for that, you need to foster an environment and show them that this is what is happening. Like the leader in a company, I believe there was a leader from senior vice president from one of the pharmaceutical companies. I don't know the name, but he came forward and said, I have mental health issues. I have neurodiverse issues. And this is how I'm dealing with during COVID time. And it was really hard for me to manage this. And now what happened is the employees, especially with people with disabilities, started identifying more. They started bringing up they started trusting the leadership, that this leader is not just talking or just pinkwashing, or not pinkwashing, I would say, not just branding, but they are intentional in what they're really trying to do. And it created so the rating of 1% in disability went up. And usually when you do all this promotions, you only find probably 1% of the population change. I mean, 1% increase, because
Right.
people don't want to trust you. And we are not just talking about LGBTQ. If you take people with disabilities and even veterans, people who have been discharged not in a good way, there are protected veterans, unprotected veterans, and also you see the people with disabilities, neuro disabilities, ones who are visible disability versus non-visible disabilities. For me, I have cardiovascular issues. I'm very open about it. I don't really care about HIPAA here, but I have cardiovascular issues. And when I talk about my cardiovascular issues, I'm also not just talking about, I'm also worried if my boss would think that I am capable or I'm not capable. And I'm a neurodivergent person too. I'm somewhere in the autistic spectrum, very mild in the autistic spectrum, and I have dyslexia. So I don't talk about this. And when you look at me, when I'm talking, you probably never figure out that, Celia is got all these issues. But to me, it's important. And when you really go down to the part of LGBTQ community, when I really spoke to them and asked them, what would it take for you to identify as gay, as bisexual, as pansexual? What would it take for you to identify? The first thing they said is, I don't trust the leadership.
Right.
And that is a big question. For that, you can't just open one day and say, we're going to have self-ID and everyone needs to identify, you're welcome to identify. They will not do that. And don't expect that happening unless you change your leadership attitude, the culture within the organization, show more trust, show that you're accepting to the community, show that you are also accepting to the external side. Now we're talking about your patients. What if your patients are trans? Now here's an example, classic example I will tell you for the person who asks you this question as to why do we need to ask this question? If a person is trans, and if your data intake form just says that you're male, female, or sex at birth, it doesn't even say gender at birth, it says sex at birth. So let's say I want a data about an adverse event. I'm trying to log in as for an adverse event for a drug. When I put my data in, what happens is it only shows male, female, and sex at birth. So it takes my data as male. But if I'm going through hormonal changes, none of that is recorded. They don't know that I'm a trans person. And pharmaceutical companies have made a lot of mistakes, especially in clinical trials, even in post-clinical trials, post-marketed drugs. They have so many issues because they have not been mindful of communities. So when you start showing that you are more accepting to the community, when you have external job sites where you're applying for a job, and when you're able to collect the data, when a person is joining the company itself, you see a lot of change with your internal employees. So if your employees have been around for 15 years and suddenly one day you wake up and say, hey, we want to know what is your sexual orientation, of course there's going to be a problem. But here's the thing. When you change in your job site for new employees and recruits and interns who are joining the company, now what's happening is, this is a statistics that's done by Deloitte. Any self-identification, if it's captured within 1 year of the person joining the company, that's the way you want to capture the data. And I found that companies like in China and India, they almost take 1 year for them to watch, wait, and learn, and then they self-identify. Versus companies in US and Europe, when they join the company, they want to enter the data. So there is a lot of cultural difference between a person who wants to identify versus a person who's internal. And also there is an external factor of how you are showing your inclusivity to job seekers, to your patients, to your consumers. And when you show that whole 360-degree inclusivity, you will change your employees' mindset, and they will feel like, oh, I definitely want to identify because I trust the company. I see that practically there. And then you can make the change, but don't make it immediately. But do a thorough analysis, and then when you do it, combine it with other issues also. Talk about people with, don't just only focus on LGBTQ, combine it with disabilities, also combine it with people who are veterans, because that cuts across all intersectionalities. And it's much more easier when you are compassionate to when you show the compassion, when you show your marketing and media for these three communities, it creates that you're not just ostracizing only LGBTQ, but you're also including other communities. It gives a good perception for people. I'm just giving away all my trade secrets of how I've done it, but I think that's what we should do, right? I mean, we want to learn and we want to do it. So it actually, even pronouns made a big change in companies. And when I started educating, it's a change management issue, right? Communication, why you're doing it, why you want to do it, what is it, how to do it, process change. You want to mindfully change the structural change, behavioral change. So you want to make sure everything is captured correctly before you bring in a change, even a process change for Six Sigma, right? We all know how to implement it, but you have a lot of procedures and process to follow. And that's how it is for self-identification and self-disclosure.
So it's interesting you talk about this idea of Six Sigma and change management and the like. Applying it to the pharma industry, one of the key pieces that the FDA has recently been focusing on is this idea of risk-based oversight or audits, if you will. I'm going to apply something that doesn't apply here, but I'm going to take it anyways from the FDA. Is there an argument to say we apply, and the reason I'm asking this is because it actually came up for me recently, this idea that we'll start with checking off gender, making sure that we have a gender diverse leadership. Then we'll look at race and we'll make sure that we have a racially diverse leadership, and then slowly work our way down. And the idea being that as we work our way down, we will get more information. So we approach it from a risk-based perspective. We don't say everything all at once. Or is that, for lack of a better term, number one, we're starting to characterize one intersectionality to be more important than another intersectionality, and that is inherently problematic. So I'd love your take on that.
Yeah, I think when it comes to ethnicities, you want to focus on all ethnicities when you're looking at it, because if you're doing a diversity in clinical trials and you're starting with the FDA, what they're asking for you to be mindful of Latinx community, Black community, Asian community, indigenous population. So race, you want to address it in a separate way. You want to address it together. And when it comes to LGBTQ community, that's where the stigma starts, right? So I've seen companies on EEOC, especially, they're trying to also bring in male, female, and gender non-binary. And even in California license, you already have gender non-binary. And they're trying to bring this in, and they said it's going to be 2024. I don't know. Maybe they're still exploring that, but it's coming soon, because there are lots of employees who don't identify as male, female. For me, I don't identify. I put in gender non-binary. There are changes that comes in, but it's good for, especially when you're looking at sexual orientation and gender identity, you want to combine that together and then put it out there. But you also want to be mindful of not excluding anyone. So when you're saying that, it's heterosexual, or when you're talking about homosexual, then there has to be a drop-down box that talks about, what is your homosexuality if you want to identify. What is your sexual orientation? It could be pansexual, asexual, bisexual, gay, lesbian. So there are lots of categories which companies have already started implementing just to collect the data. And there are folks who enter that, and sometimes they say, I don't want to give that information because I don't want people to get that. So that's also one thing. And when it comes to gender identity, of course, you drop down and enter your data, and gender non-binary, or you can say that you're gender fluid, gender agender, bigender, all this you can enter in that. So when you just take the LGBTQ community alone, especially when it comes to how do you implement it, there is a stigma. The stigma will exist. It'll look like they're targeting us, and they don't know the purpose why. So that's why it's always good to take the other categories, which are human categories, where people with disabilities or folks who are in the veteran side, folks who are protected veterans, and combine all those three and implement it. So there are lots of guidelines today in the DIC. I've been doing some consulting in this space. There are lots of categories that are within even the protected veterans, and you want to take a look at that. There are lots of categories. And the stigma, in fact, when I was doing this for one of the clients, I found that the stigma around people with disabilities is even higher than the LGBTQ community. Trust me.
Wow.
Because in the LGBTQ community, if you say you're gay, and if everybody's okay with it, I don't care, you're gay, just do the job. Let's do the job. It's done. But when you say you have autism, now the stigma is, oh, I don't know if you're really capable of doing this job. I didn't know that you have autism, but the stigma is even much more higher because you're not just focusing on a sexual orientation, which doesn't really affect your workplace issues, but now autism, they feel like it affects your workplace issues. But when this person says, look, autism, it's not an issue that's going to affect my promotion, it's not going to affect my performance, they don't understand that. And they don't accommodate as to why you feel agitated when I'm talking about something. Why are you squirming in your chair? Can't you sit properly? There are reasons, because a person is uncomfortable. They have anxiety attack. When you say certain words, they get triggered. So the same thing happens. So it's much more closer when you bring these three communities and try to implement, or always keep the LGBTQ and the people with disabilities when you implement it. If you want to do veterans separately, that's totally fine, because a lot of veterans also have mental health issues, and 70% of the LGBTQ community, they have mental health issues. So there is similarities between this, so it'll be good to implement that and also start thinking about how do you want to frame your clinical trials, how do you want to ensure your interaction with the customer intake, even your doctor's visit, how do you want to make sure that it's mindful when the person is in this category. I found that it's much more easier when you break it down and then focus on these issues.
Today's discussion for me was more the importance of DEI because of the changing climate associated with it. We definitely need to do a deeper dive into DEI in the context of clinical research, DEI in the context of promotional compliance, if you will, and how to bring all of that together. So I'm excited for each of those to happen. But before we sort of call it, one last question. How can people reach you if they have questions?
Absolutely. So if you just Google Celia Sandhya Daniels, you will find me. Not that I'm so popular, but nobody has that name, Celia Sandhya Daniels. But you can find me on LinkedIn, and my email is celia@rebicon.com. That's my company. And I'm on LinkedIn as well. You can go on LinkedIn and search for Celia Daniels, and my profile will show up. And you can also contact Darshan. Will also provide you my information about where to find me. But I'm on, if you at Celia Sunday Daniels is on Twitter and Instagram. So that's my handle.
Wonderful. Celia, thank you so much for coming on. This was amazing. I appreciate you talking about the importance of representation, the value, and sort of some tips on how to do it right. But what we're going to do is do a deeper dive into setting up reimbursement strategies, clinical research, even healthcare, and how all of those things will start fitting in together to have better representation as we continue. So thank you again for coming on.
Thank you, Darshan. I'm glad to be here.